Welcome to the MicroGenDX Mic'd Up Podcast. Discover how cutting-edge next-generation sequencing technology is revolutionizing medical diagnosis, empowering healthcare professionals with rapid and accurate identification of microbes. Our experts take you through the science behind microbiome testing so that you can make better decisions when it comes to patient care. Plus, hear stories from patients firsthand about their journey toward better health. Let's get started.
You're listening to MicroGenDX Mic'd Up, where we explore the next generation of infectious disease diagnostics. I'm your host, James Compagno, and today we're joined by Dr. Heidi Peterson. Dr. Peterson, can you please tell us a little bit about yourself?
Yes, hi, I'm Dr. Heidi Peterson. I've been a practicing naturopathic physician since 1999, and I specialize in women's healthcare, environmental medicine, and chronic illnesses.
That's great. Can you please share with us your educational background, including your work with ONAP and ANAP?
Well, I was on faculty at, what used to be called NUNM and now, or it used to be called NCNM and now is NUNM, and I taught gynecology there for 19 years. And I've been members of both the Oregon Association of Naturopathic Physicians as well as the American Association of Naturopathic Physicians since I became a doctor.
Well, it seems like your focus and background is mainly on women's health. Am I right in saying that?
Well, I've always had a passion for women's health, and there's unfortunately a long history of women being dismissed in healthcare and not being taken seriously in women's healthcare, women's health issues not being researched, and I would like to rectify that.
Well, I'm glad you are working to rectify that. It's very valuable to us at MicroGenDX, and we're really working to rectify that as well and get better testing to women. How did you find out about MicroGenDX? Was there a particular patient or case that was the reason you were searching for new testing technology?
Well, it's kind of funny. Actually, a patient brought it to me. But I was really primed for it because when I was in school and I learned about conditions like interstitial cystitis or vestibulitis, we were always taught, well, the patient presents like they have an infection, but the culture shows that they don't. And I always sort of thought, well, I think they have an infection. And over the years, I had tried various other laboratory techniques for finding the infection and interstitial cystitis and just was never really satisfied. So I had a patient actually approach me and said, hey, will you run this new lab for me? And I looked at the technology and it seemed a valid methodology. And I said, sure. And then ever since then, I've been running the test.
So could you go into how you're currently using MicroGenDX testing and what you are looking for or needing the test to provide?
Well, it kind of depends on the patient history, right? So, the urine testing I will use for interstitial cystitis. I will also use it for urinary incontinence. So there's quite a bit of research that older women who have urinary incontinence have subclinical urinary tract infections, and treating that makes a huge difference for them. And there's not really great treatment options for women with urinary incontinence. So that has been an area that it's been really, really helpful with me. Also, obviously, chronic vaginal infections, vestibulitis. But, there's also with systemic infections. So in naturopathic medicine, we always are thinking about what we call dysbiosis and looking at sort of overgrowth of pathogens in any place in the body, leading to even systemic illness. So now I've had certain situations where I've had patients with chronic illnesses and we're looking for the driver of it. And then I'm really just testing various parts of their bodies, looking for the infection that's driving their symptoms, where their symptoms might not be in the organ system that we're actually testing.
Well, speaking of these cases in dysbiosis, could you give us a good case example, like what really showed MicroGenDX was very powerful for what you do?
Well, probably my best case for this is I had a gentleman come to me with weight loss, and he was having to eat 5,000 calories a day and was losing weight. And he'd seen multiple providers, and they had done he had done maybe half a dozen different stool testing, and people kept testing his stool, trying to figure out why he was having malabsorption. And then at a visit, I was chatting with him and I said, well, when did this all start? And he said, well, this started 6 years ago when I had prostatitis and a UTI. So then I thought, okay, well, we should run MicroGen. I ran the men's complete panel, and he had pathogens in both his prostate and bladder. And once I treated those, he actually started to gain weight. Now, I don't think there's any medical literature on it, but it worked. He maintained his weight for several years. A couple of years later, started losing weight again. We ran the men's complete again. Pathogens had returned. We treated him again, and he started gaining weight again. So it's definitely been reproducible. I don't exactly know the mechanism of that, but it is clearly helped him. But he wasn't having any, any urgency or burning. I mean, there was no symptoms that you would have, except for the history, that would have made you think to look in the bladder.
Speaking of prostate tests, though, it is one of our tests that we do allow patients to collect at home with doctor approval. We offer several of these at-home sample collection methods. Is that something you're doing, or are you collecting all your samples in practice?
Well, I think it really just depends on the history. I mean, and where the patient is, and if I'm doing telemed or if I'm seeing them in person. Generally, for the men's complete, I'll let them collect the sample themselves. I don't really feel like there's any benefit, and I don't need to assist them in that collection. For the women's complete, sometimes I collect the vaginal swabs, but sometimes they collect them themselves. I think probably I do a slightly better job with the vaginal swab collection, but I don't think it's that hard. For the sinus kits, I'm definitely collecting those because I think they're harder to do. And for some of the other kits, like the skin scraping, I'm usually helping with that. But I think for a motivated patient, any patient could collect them on their own.
Thank you for that insight. We really wanted to allow the doctors to make the decision on whether or not the patients collect at home. And as you said, for certain tests like the semen collection, it's really something that is better collected at home. Have you seen any other cases similar to the one you described earlier where the patient was failed by culture repeatedly prior to trying NGS with you?
Oh, absolutely. I have tons of great cases. I mean, there's there's a classic woman that has the chronic bladder infection, and she comes to my office from her primary care physician, and their solution is, well, just take an antibiotic every time you have sex. Well, that isn't really a healthy way to live. And she'd had this for over 10 years and had seen numerous providers. And then I just ran the MicroGen urine test. We actually found the right pathogen and the right antibiotic. And then I followed up with some women's probiotics. And now after, now that's been a good solid 3 years, and she hasn't had a UTI and hasn't taken an antibiotic every time she had sex. So that was a nice sort of simple case. Probably my favorite case to tell people about is a poor woman with vestibulitis. She had stayed at an Airbnb and got in the hot tub and got a vaginitis, which is a risk for all women if they're swimming in maybe the not most clean water. And she was treated many times at her local primary care office for a yeast infection, even though the culture didn't show it, which I always think that is interesting. And she kept having vaginal pain. And then she was sent up to OHSU, our research university here in Portland, Oregon, and they were treating her with a couple different pain medications, and she still persisted to have pain. And their next recommendation for her was actually a surgical procedure to remove the vaginal vulvar tissue that was hurting her. And as you might guess, she wasn't really wanting to choose that option, and she ended up in my office, and I ran them, the MicroGen Women's Complete, and I think she had like 14 pathogens in the vaginal swab and maybe 4 or 5 in the bladder, and it took several rounds of treatment to get that all cleared up. But now we're probably 3 years out from that case, and no pain and no surgery. So that was a huge win in my practice. And like I said earlier, I've had many women with incontinence, which I think incontinence is maybe one of those taboo topics that a lot of women don't like to talk about. It's embarrassing, but it really affects their lives. And, I certainly know, women that don't leave their home, or they're afraid to exercise, which is, of course, really vital for their health. And it really impacts their life. And the treatment options are really drugs with not great side effects, or various pads or devices to put in the vagina. Like they're not really great treatment options. And so, this woman, I ran the urine panel, and she had some pathogens, and we treated her, and now she happily reports back to me that she can go to the gym and do her aerobics workout and not leak at all, and not have to worry about a pad or anything else. So those are definitely some life changing situations for my patients. I have another patient who had a very sick woman with multiple health conditions, and she started having some bad bladder pain, and she definitely had pathogens in her bladder. But what was really interesting in her case is, as we treated her bladder and her bladder got better, her joint pain got better, her overall systemic inflammation got better, and even some digestive system symptoms improved. So, I think that, as we're taught in naturopathic medicine, microbial imbalances anywhere in the body can cause inflammation and systemic uh, effects. And often with my really sick patients, I'm really trying to sleuth the driver of that. And MicroGenDX testing is just another tool that I have in my box to try to find the driver of the chronic inflammation in my patients.
Unreal, especially that woman with the 14 different pathogens that you saved from surgery. That is a fantastic case and a great example of the use of MicroGenDX technology. When you talk a lot about dysbiosis, could you go into that a little bit more, what you mean by that? And is it just a gut issue, or are there other sites on the body that should be concerned?
Well, I think that, we've been, from day one as a naturopath, I was really taught about GI dysbiosis, and I think we're always looking to the gut first. But I think, as some of my cases have showed, that sometimes the problem isn't in the gut. And I think, if you're having a hard case and you've really stalled out, and you're, wanting to see what the driver of autoimmunity or the driver of inflammation is, to really look in different organ systems. And I really don't know any other testing besides MicroGen that's going to give you the results that you're going to look for. Also, I certainly would recommend them for, any sort of, chronic vaginitis, chronic UTI, chronic prostatitis. All of those kinds of symptoms have been hugely helpful in my practice. But, really one of the great things about MicroGen is I love that you guys will test almost any tissue body. And I've, run the oral test on a few patients. I think it's great that you test the tissue for breast implant. I've definitely sent some skin scrapings in. I've run a few sputum ones, and I think in those really, really hard cases, it's just great to have another tool to test to try to find the cause, because that's really the philosophy in our profession, is to treat the cause. And if a chronic low-grade undetected infection is the cause, then the best thing is to diagnose it and treat it.
Thank you for taking full advantage of all the different sample types that our lab offers testing on. They've worked very hard on that, and I'm sure they'll be grateful that someone is appreciating that.
Yeah.
In that case with the woman with the 14 pathogens, what did you look to treat first, and how did you approach treating it?
Well, I think it really depends on the patient. And, certainly as naturopaths, sometimes we treat with antibiotics and sometimes we don't. In that case, I because it was sort of, I felt like I had to make a home run on my first treatment plan, because this poor woman otherwise was looking at surgery. Initially, I treated with antibiotics. One of the things that I like about the MicroGen reports is they give you a nice spreadsheet of all the possible antibiotics, and you can really kind of target and choose the best antibiotic that's going to cover the most pathogens. So for her, on the first round, I looked at that nice spreadsheet and I chose the antibiotic that I thought would cover the most of the pathogens and the pathogens that were there in the highest number. And I think I did a couple rounds of antibiotics. Then what I find in my practice is, particularly when there's so much dysbiosis and so many pathogens, sometimes after a while, the antibiotics don't work as well. And then I'm moving on to more natural treatments. So I'll do some herbal treatments. I definitely always use a biofilm agent. And I think, that's a point that I should have made earlier. I think the PCR testing is really detecting pathogens and biofilms. So, I always use some sort of natural agent to break down the biofilm when I'm treating infections found on my MicroGenDX. And then finally, in the really hardest cases, I'm a certified in ozone therapy, and I've been using ozone therapy to sort of do the final healing for my patients. And so I think as a naturopath, we have many more tools to fight infection besides antibiotics. Sometimes antibiotics are a good place to start and the cheapest place to start, but there are many tools out there, and sometimes particularly when we're trying to rebuild the microbiome, it's sort of trying to like rebuild the rainforest. At certain points, the antibiotics aren't always the best choice, in my opinion.
Do you test after treatment to confirm the reestablishment of a healthy microbiome?
Sometimes not. Unfortunately, there is a cost question with retesting. And I would, as a scientist, I would really prefer that my patients always retest. I think practically in a clinical situation, a lot of my patients don't, if they feel better, they don't want to retest. Now, in the patients that come back with numerous pathogens, say 14 pathogens, I'm really upfront with them, and I'm going to be like, we're probably going to do several rounds of testing and treatment to really resolve this. And I'm really clear with the patient that it is a good investment to do retesting and treat till the microbiome is totally healed. Whether the patient wants to invest that money or not is really up to the patient.
Thank you, Dr. Peterson. Do you have any final thoughts to say to your naturopathic colleagues?
No, I just want to encourage my colleagues to try out this testing. It's been really life-changing for my patients. It's really affordable. It's really easy for the patients to collect, and the reports are really easy to interpret. And I think it's just a great another tool that I like to be able to grab for.
Dr. Peterson, thank you very much for joining us.
Thank you for tuning in to MicroGenDX Mic'd Up. We hope that you found our broadcast informative and helpful. If you have any questions or would like to learn more about our services, please visit our website at microgendx.com. Power up your precision with MicroGenDX testing, the key to accurate diagnostics and personalized treatments. Until next time, this is MicroGenDX Mic'd Up signing off.